And just like that, Josh, here you are.
Here I am. Happy to be here.
I appreciate it, man. So, I saw you a couple weeks ago, and somehow or another, we organically started talking about a podcast, and you had mentioned that you have this event coming up here in just a few days that's going to be here at Red Buffalo, which is also where I host the Appetite Show from. And so kind of tell me what it is that you do and what the fundraiser – is it a fundraiser?
It is a fundraiser. Yeah, absolutely. It is a fundraiser, but also a partnership with Joe Bondi here at Red Buffalo, who has always been supportive of firefighter issues here in Statesville.
And Joe's always been a big, since he's been here and started Red Buffalo, he's been a big, huge advocate and supporter of Statesville and local business and our emergency services like the fire department. How long have you been a fireman?
It'll be 20 years here in a few months.
Wow.
Yeah, I'm a lot younger than I look.
So if you do 20 years with the fire department, can you retire at 20 years?
No, here in North Carolina, firefighters have the same retirement really as any other public worker. Probably shouldn't be that way, but that's the rules we have on the books. We have to do 30.
30, okay.
Now, one positive aspect of that is there's no minimum. A lot of states, you have to be 50 or 55. Here in North Carolina, you pull your 30, and you're done. You can retire with full benefits. I started when I was 19. So so I'm going to be enjoying my retirement around age 49.
Oh my gosh, that just seems so wonderful, but yet I'm so mad because I will not be unless one of these scratch-offs hits or somebody hits the Mega Millions and they meet. Otherwise, I'm gonna be working till the day I die.
Yeah, well, now if that happens, I'll be out at 20 as well.
Oh, 100%. So if you worked in the fire department as a volunteer, let's say there's a junior fireman, right? So you can get introduced early, then you become like a volunteer fireman in high school.
Yeah, sure.
Does that count as years towards?
No. So it's sort of separated in between. Volunteers do have a pension. It's a very small pension system here in North Carolina. For volunteers, they have to pull 20, and then they get a small stipend when they turn 55. But a lot of firefighters I know, a lot of firefighters I've worked with over the years, they do start as volunteers. Volunteerism is pretty big in North Carolina. However, about 90% of the population is protected by professionals. So when you look at population base, think about the city of Charlotte. A tenth of our population in North Carolina lives in Charlotte. They're protected by a professional fire department. Same thing here in Statesville. All the residents that live in the Statesville city limits are protected by Statesville firefighters.
And you guys, when I used to work in the emergency department, it seemed like every time there was an EMS call, the fire department, someone shows up. Is that right? That's
absolutely accurate. We do medical calls, and they're coded. So when you call 911, the dispatcher, the telecommunicator will ask you a series of questions, and based on those questions determines whether they dispatch the fire department or not. But the down and dirty version is very much that if it's a bad call, they're going to call the fire department.
It seems like from my viewpoint, growing up, the old joke was, the fireman helped get the cat out of the tree for the old lady, right? Those days are past, man. You guys, I see you guys around a lot.
Yeah, and the fact is, in most locations, if you call a firefighter for some reason, you're gonna get their service. Firefighters are stopgap public servants as well as emergency public servants, and what I mean by that is they call the fire department when they don't know who else to call. Your great aunt locks her medication out of her car. She needs that medication. The fire department's going to come open that door for you. Your cat's up in a tree. The fire department will come help you. Cat's caught in storm drain. Ducks in fishing wire. We've been on those. Dogs in wells. Done it all, man.
Done it all.
Done it all.
Funny because my cousin this weekend had to use your services. I don't know if you specifically, but he accidentally fell into a 15-foot hole.
Oh, wow.
Yeah. So the fire department and EMS had to come lower a ladder and help get him out.
Wow. 15 foot. That's a pretty good fall.
Oh, yeah. It was impressive. It could have been a lot worse, but thank goodness that, someone was there available with the right equipment to get down there and get him and get him out. Some of the things too I've noticed, it seems to me that police officers, which I love the police, respect the police and our first responders and our fire department, but when it comes to like the physicality of what you guys do, it didn't always seem like there was a lot of, say, out of shape firemen. Mm-hmm. Is that fair to say? You may see some other people who are in EMS or in law enforcement and even nurses who may, could do some few pushaways.
Right.
But not so much in the fire department.
Yeah, I mean, so the fire department is governed by NFPA standards, and not to get too deep in the weeds, but the NFPA standards dictate that there's a standard called NFPA 1582, and 1582 basically is a very stringent list of standards that we have to meet to be considered physically able to do our job. And in fact, you would probably know this, but our physicals are done here in Statesville at Art Memorial and at the cardiology center. And this is everything from a spirometer to an EKG, push-ups, sit-ups, Jackson strength machine. Mm-hmm. Every Statesville firefighter that you see goes through this annually. And quite frankly, in every professional department across the country, with a few exceptions, it's a national standard. So you may see some firefighters that look out of shape, but at the end of the day, you can at least count on the fact that they've probably been through that rigorous test.
I don't know if it seems like everyone who's in emergency services should be able to go through that type of a test every year. Law enforcement, EMS, EMTs, paramedics, nurses, anybody that's doing a high stress physical job. It just seems like, physical fitness would be real high on the priority, along with training, of course.
Yeah, I think, EMS, I think, seems to be a different sort of mentality. Most EMS services now are moving to 12-hour shifts. Same with law enforcement. Firefighters are still on probably a pretty draconian 24-hour, 48 off schedule, and there's a lot of health issues that come along with that. You're waking up in the middle of the night from a sound sleep, and you go from 0 to 60 in literally 60 seconds. We also have national standards. We have to be dressed and on the truck in 60 seconds.
Wow.
And so a lot of these things, are great for the fire service. They're good standards to have. They're best practices. But at the end of the day, we're not competing with those other emergency. You couldn't expect a nurse to work a 24-hour shift.
No, as a matter of fact, legally we're capped at 16.
Right.
And after you hit 16, you got to go home.
Yeah.
Now I think you have to go home for at least 4 hours and you can come back.
Wow.
But you can't work. I never did that. I used to pull as many 16s as I could, but you can't work. And actually, I don't think any more residents in residency. I don't think they can do 24-hour shifts anymore. I think they've capped them too. Because honestly, once you're up for that long and you're in a high stress situation, you start getting foggy. Like I used to feel a little like sick, like almost like flu-like symptoms at around hour 14 to 16. Like, get me out of here.
Right.
It starts getting not safe for you, but patients and hell, everyone around you. I mean, you guys are driving a truck.
Yeah, that's right. And one of the things they've always sort of studied like the sleep patterns and other things, but they're finding some pretty significant health issues with those, especially busy firehouses. So one of the things that they figured out happens is firefighters are very susceptible to low T. And, this is a little bit bigger problem than the bedroom. What they figured out is low T weakens the left ventricle and can lead to heart attacks.
Yes.
And so by default makes firefighters more susceptible to heart attacks, among other things.
I had a physician on last week, and he's a urologist, and he specializes in men's health. And, one of the things, like men, when they start noticing they're having less nocturnal erections or less morning erections, that is a sign of heart disease.
Yeah, high cholesterol and other things.
Oh, I mean, I'm checking all the boxes, dude.
Yeah, absolutely. yeah, no, absolutely. Yeah, so firefighters have a lot to deal with in terms of health, for sure.
So you started becoming a firefighter at 19 years old, and then how has your path moved forward to where you are now?
Man, that's a long, tough question. But basically, I sort of had two sort of not competing interests necessarily, but different interests. I was very interested in politics and public administration and the public world. So I pursued that academically. And so I worked at the fire department, did a 2-year degree program, went on to App State, did a master's degree program in political science and public administration. And I finished my doctorate a few months ago, almost a year ago now, in curriculum design.
Doctorate?
Yep.
Doctor?
Yes, doctor.
Dr. Smith.
Dr. Smith, yeah.
Man, you're one of those wicked smart dudes.
Yeah, well, nothing like that. Definitely not smart, but very determined. But during this time, I got the chance to interact with a lot of different people. I did a lot of campaign work. I did a lot of campaign finance work. Worked on legislation for firefighters here in North Carolina at a pretty high level. Wrote a lot of policies and a lot of bills that we have here in North Carolina for firefighters, and it's kind of led to quite a bit of other doors opening up. So I currently serve as the governor's appointee to that is Governor King Cooper. Depending on what side of the political aisle you're on. But I am King Cooper's appointee to the State Teachers Retirement Board. Was Wayne Goodwin. Now Mike Causey is in there. I am one of Mike Causey's appointees to the Fire and Rescue Commission here in North Carolina that oversees fire and rescue training and other matters in the fire service. And I serve on the North Carolina Certification Board that governs certification and professional standards for firefighters. On the state level, I'm the political director for the Professional Firefighters and Paramedics in North Carolina. That really allows me to travel the country. On the international level, the International Association of Firefighters, I teach a class called State and Local Training, political training. It's called PTA, and PTA is all about what firefighters can and can't do in terms of campaign finance, in terms of super PACs, and how they can interact with the political system and not get in trouble.
So it's interesting that we're in this political climate. We have obviously the big election coming up, and so what is it like for you to have like the average schmuck like myself? I don't understand about campaign finance laws and the fire department in this here. You're not a union, right?
We are a union.
Can you hear me? Oops. Maybe I can hear you. I don't know. Can you hear me now?
I can hear you now. Better.
I can't hear you though. That's weird.
That's not good.
That's not good. I have no idea. This could be working. I don't know. But can you hear yourself?
I can, I think.
Through your...
Let me take this. Well, I couldn't hear it through there. Low battery. Oh,
Hello? That's bizarre. I have no idea. Talk to it one more time.
Hello.
It's
Hello.
getting nothing.
Oh, it's supposed to.
See me?
Oh, yeah.
Right there?
I'm not doing that.
You're not getting that. Okay, ladies and gentlemen, take a pause. That's a first. And the good news is I don't edit. I don't know how to edit. We'll figure it out. I have no idea. How about now? Good try. Headphones on select. All right, now try it.
Rumble. Here we go. I'm not sure these headphones.
No.
All right. Are we rolling?
No.
We are not rolling.
So I have no idea, but here's what we're going to do. And we're just going to share this mic.
Yeah.
That's what you have to do. Problem solved.
Problem solved.
So in this political climate that we're in, I don't understand a lot about campaign finance laws. You hear a lot of talk about that in super PACs and this and that. And is there any way that you could give like a watered down dummy version that I could try to understand that?
Well, probably not. But
Thanks. Appreciate it.
But no, basically, we really have sort of to make it easier to understand. So we are a union. So where I serve, the International Association of Firefighters, that's like our NRA, big group in DC. Our building is 3 blocks from the Capitol. And then we have a state organization, Professional Firefighters and Paramedics in North Carolina. That's the organization that I serve the political director of. We also have a charitable fund if you'd like to donate to that. Right now we're helping some brothers down in Louisiana having trouble from hurricanes. And then Statesville here, we have the Statesville Professional Firefighters, and that's the local chapter of our union. And basically, it's very simple. The local works on local politics. We work on campaigns here in Statesville. We work on policies here. We've just been in a pretty big fight with City Council concerning our pay. So those are things that we work on. At the state level, we work on state legislation. And at the national level, those guys up there, they work on national politics. Mm-hmm. As far as how we interact, each level has a PAC fund. We also have the ability to run super PACs or independent expenditures. Independent expenditures are basically exactly the way they sound. Independent expenditure and super PAC are essentially the same thing, but they work basically like it sounds. It's an independent expenditure. So if Brandon wants to run a campaign or a issue separate from the campaign, you can use any source of money that you so choose, but you cannot coordinate with the campaign. So we'll use our good friend Joe Bondi. Let's say Joe decides he wants to run for city council.
Yep.
If you never say a word to Joe that you're working on this independent expenditure around expanding a law here in Statesville that allows us to walk around with open container, right? Which I think we're both for.
Yes.
You and I could take our personal money. We could each take $20,000 a piece and put in this campaign. If we never talk to Joe or Joe's campaign about it, it's perfectly legal.
Really? It's a workaround.
It is a workaround.
Right.
But it is a workaround that many have went to jail for. Right? It's not something the federal government or the state board of elections finds funny. They think they have no sense of humor, and they really particularly they will and do target local, especially public organizations, because there's already sort of this negative connotation that public workers are doing this stuff on the public dime, and there's lots of things there that can cause problems. But if you're just donating to Joe's campaign, for example, you have here in North Carolina, you have a $5,200 limit, right?
So as a private citizen, I could donate $5,200 to Joe Bondi's campaign.
That's it. And
I could also, without Joe knowing, I could be running this independent thing with you and donating $20,000 over here.
Yep.
Totally legal. I just can't tell Joe about it.
That's right.
Okay. I like it.
Yeah, Joe's campaign could know nothing about that. Now there's all kinds. I mean, we could do 10 podcasts about this. There's a whole this is a whole political world that exists out there. My job for the international and some here at the state is really to make sure that firefighters understand these rules and understand how they can most benefit from those rules.
To back up for a second, you were talking about the Statesville Police Department and pay. Is the fire department well funded here, in Statesville and just overall in the state of North Carolina? Because the reason I ask that, I don't see a lot of firemen need help. Now, I get phone calls for police, I get phone calls for state troopers, but I don't get a lot of phone calls for the fire department. Does that make sense?
It does. The firefighters do not do well here in North Carolina. They're about 43rd in pay nationally. 43rd. Yeah. So
not good.
Yeah. So you see a lot of the teachers, for example, have been out there, really showing their pay and at the bottom of the pay scale. But North Carolina traditionally ranks somewhere between 43rd and 47th in pay. We are one of only 8 states without a dedicated public safety pension. So 42 other states in the U.S. have public safety pensions, meaning that police and fire are together in one pension. And typically that means either the payout is higher or the years of service are lower. So you mentioned 20 years. There are no 20-year pension systems that I know of, but there are 25.
Okay.
And 25 is very common for police and fire.
So would one of your goals be to get a pension, but get the pay up in the state and get something better than 43rd to 47th? I imagine that's something that interests you and the people that you're, I guess, representing.
Yeah,
right?
Sure. Yeah, I mean, and the reality is, from a state perspective, we can't do much about that. The localities set the actual pay numbers, but the pension system is a statewide system. I mentioned I served on the board, and it's one thing that we're actively working on is a better pension. Our pension system is very good here in North Carolina. Public workers have a very strong pension. It's typically top 3, sometimes number 1 in what's called solvency, so the funding level. We're always high in that, but we're also pretty low in payout, which is kind of an easy thing to have, right? You're not paying out as much money, it stands to reason that you have more money. So it's one thing that police and fire together are working on to come up with a solution that allows, we really don't need 55 and 60-year-old people riding fire trucks and going into burning buildings, right? But we have a number of those here in North Carolina. So yeah, that is something that we actively work on. Another big legislative issue is cancer. Firefighters are 10 times more likely to get certain kinds of cancer than average civilian. So I have worked on legislation that's led to some good results, but we still have a long way to go. Our local organizations have pushed really hard as well to work on some of these. We constantly kind of have this back and forth with who's going to pay for what, because the state sees some things as their obligation and the local see others as their obligation. But at the end of the day, firefighters are good for North Carolina. Firefighters are typically active in their community. They give back, and they provide a very important service.
Is there a specific cancer that you guys have an increase in? Like, for example, I would just assume lung cancer because you're around smoke. Is that, or is it just cancer in general? Renal cancer, prostate cancer, lung cancer, brain cancer. It just seems like there could be more for the people, the true heroes that save us on a daily, hourly, minute basis. You should have better pay. You should have the best health insurance around available.
Right.
You guys should be able to work 20 or 25 years and be able to retire with a good pension and whatnot. Like you said, it's not good for a 55 or 60-year-old man. It's not good for him. It's not good for the person, I imagine, above him, below him in the fire, and also the person that persons you're trying to go save. So it just seems like that would be almost like a common sense, like, hey, let's take a look at this. But there's so much more to it than that.
Yeah. Yeah.
Man, you fight a lot. You got a lot of battles ahead of you.
Yeah, absolutely. Yeah, absolutely. Well, and that is the common misconception. So one of the things that most people think is that the cancer comes from smoke and that lung cancer is the highest. But really what it is it's absorption. We wear this very heavy, thick gear that traps all of these chemicals in our body. We go into a fire and it's 30 degrees outside, but we go into a 1,500 degree environment, and now we're sweating, immediately, and our pores open up, and all of these chemicals that are now stuck to us enter our body and cause mass damage. So lymphoma, is big. One of the reasons we're here, and I know we're going to get to it, is to talk about our charity event on Wednesday night.
Perfect segue.
But part of what we do here locally is we maintain a benevolent fund, and this really dates back almost 20 years now. About the time I came on, a gentleman named Dale Price was a lieutenant here in Statesville and got cancer. And at the time that this happened, it had not ever happened in our fire department before, and so we had to really scramble to make sure that we had resources to help his family. So we put on a golf tournament. We did a silent auction. We passed the hat. We did whatever we could do to raise money for his family, even simple things like hotel rooms at, Baptist hospitals, so they didn't have to travel back and forth. And when that sort of took its course, we made the decision, as a group that would never happen again. And so we make sure that we maintain what we call a benevolent fund, and we really try to keep that fund at a high level. So if any of our guys are in trouble, or ladies, we have the funds available to help them. And this is no different. One of our members has testicular cancer, and testicular is one of what we call firefighter cancer. The CDC identifies 9. And testicular is one of those. And more than likely this year, breast cancer will be added as well. The data is not quite there just due to not as many females in fire service, of course. But this is his second round with his testicular cancer. And we are doing everything we can, to help him and his family. He's doing this thing where, and I don't think you'll mind me sharing this, but he has a week of chemo and then 2 weeks off. Mm-hmm. And you probably understand how that works medically, but basically that's, what he's trying to do. And so that's about 15 weeks, I think. And the guys have stepped up. They're covering his shifts. There's about 50 guys that are available, and some have signed up for multiple shifts, and are making sure he doesn't have to worry about coming into work while this is going on. We've been able to help his family, financially, and not all of the money that Joe's helping us with coming up on Wednesday is going to go to his family specifically, but it is going to go to that benevolent fund to make sure that we can take care of our own when these issues happen. To answer your question, it is certainly our stance that these issues, it's incumbent upon the local governments to take care of these employees. These are occupational illnesses. There's no doubt. It's been studied and studied and studied, dating back to the 60s. Many states have what's called presumptive legislation, which means that the risk of cancer is so high in our occupation that it should be presumed that we got it from our occupation. North Carolina is one that does not. It's actually about to be the last one. South Carolina signs their bill on Wednesday, so this is timely that we're here actually to record this. But I've been involved in 2 separate bills. One was in 2015, and then again in 2018. Started in the short session here in North Carolina. Both were what's called Presumptive Cancer for Firefighters Act, and basically they would, if a firefighter were to get cancer, they would be covered by workers' comp. Again, occupational illness, that's where the tie-in is. But we've had all kinds of opposition. League of Municipalities, retail merchants, Home Builders Association. Lots of opponents out there that oppose this legislation. The North Carolina Senate will not hear the bill. The bill passed the House unanimously. If you know much about politics, it's one of the only unanimous things I've ever seen happen. But it passed the House unanimously in 2019, and then came to our North Carolina Senate in 2020, and sat there until session expired. Know much about North Carolina politics? They operate in bienniums, so they can they will have a long session and then a short session. The long session is really where the meat of the business is supposed to get done. And they come back in the short session to basically pass a bill out of one chamber or the other that was passed in the previous year. So really your legislative season is 2 years, but it's really just one biennium session, if that makes sense.
Yeah, that makes a little bit of sense. But I'm still stuck back here why it's sitting there and why, this should be a no-brainer. Is it one of those things that, it's too political of a climate? I mean, it's been sitting there since 2019. Mm-hmm. Why would it not be touched? Obviously, I'm sure you have a pretty good idea, mm-hmm. but, and I'm not going to ask you to share that. But these are the type of things that I don't know if people know, mm-hmm. but they should know. Sure. Because when it comes time to sit there and check a box for somebody, mm-hmm. and you know that there's things that they could be doing for your local fire, the state, and they're not doing it, it sways people, Or there's also things that people should know that they have signed and they have passed that they have no idea. We have no idea. We know more, I think, as a society of what's going on at the presidential level in the politics and what policies they support and whatnot. And we have way less of an idea of what even our local and city council, our mayors, and our senators and governors, what they support. Yep. And there's a way that we need to really fix that.
Yeah. Well, yeah. And I mean, it's why, when you and I talked, I was like, yeah, I'd love to come on. I go anywhere, do anything I can to get this information out. Really a lot of it, any sort of bill is, gets caught up in money a lot of times. This is one of those things that cost is tough to predict. You could have 20 firefighters this year and 100 next year. Mm-hmm. You honestly have a very, right now you have a very conservative North Carolina Senate that looks at things very much from a financial level. Sure. One of the things that I have been able to get done, and you may find this interesting, some people do, we do have it covered as a line of duty death.
Okay.
So, and when you say that, you think, man, that's great. Their family will get some money when they die. But what we want to happen is them not to die.
Yeah.
Right. and so right now they don't have the, they don't have the resources to do that. There are so many problems with the way it works now. You get cancer, you have your 12 weeks of FMLA. Once you exhaust that, the local can let you go. You have the extreme cost, of chemo and other things that really you're kind of a prisoner to the quality of health insurance that your city has. Being in healthcare, you probably know this too, but a lot of healthcare policies have lifetime caps. Mm-hmm. So if, one of our firefighters were to go in, this individual that is heavy on our firefighters' minds right now, this is his second round with this, right? So he's had surgeries, he's had chemo, and other things. So, if he reaches his lifetime cap, I guess he just wouldn't have insurance.
Okay, so there's a couple things here. Other than I'm just scratching my head, I'm a bit baffled. So, quick question for you: how is like, for example, I couldn't imagine being 16, 17, 18 years old right now thinking I want to go to into law enforcement under any circumstance right now. And I would tell my children, absolutely not.
Mm-hmm.
Okay.
Sure.
And I think they're seeing a decrease in folks enrolling into, to be a police officer.
Mm-hmm.
Are you guys seeing a drop or an increase? You guys kind of staying level for folks that want to become a fireman?
Mm-hmm. Well, that's a good question. We here locally are not seeing. We're seeing a pretty dramatic decrease, but I think some of that has to do with the benefits that are offered here locally versus
mm-hmm.
what we see in other localities. But there definitely is this culture in the fire service where if you talk to any firefighter, and I'm the exception, but firefighters will tell you it's the greatest job in the world. Call any of them right now. I know you know 10 of them that you could pull, and they'll tell you, it's the greatest job in the world. But at the end of the day, it's killing them. It's hurting their family. It's putting them at risk. No different than an NFL player that's getting hit helmet to helmet, 3 times a week. It is a very physically and emotionally taxing profession that has been glorified by lights and sirens and every small child's fantasy to go to the fire station and to be a fireman one day. There's a very big disconnect between reality and what actually goes on, and even within the people themselves. Mm-hmm. It's not just the public, comes up and says, "Man, I really appreciate what you do." It is also the guys feel that way. This is a great job. I'm helping my community. I know I'm sacrificing my body a little bit, and that's really great if you're in years 1 through 5 or 1 through 7. But when you get my age and you're 30 and those things, your body starts to break down, and getting up and down, getting on and off a fire truck, running and burning buildings where there's toxic gases and very, very high temperatures, and you're sweating and these toxins are coming in your body. And oh, by the way, you got on the truck in 60 seconds and your adrenaline went up and your T went down, and now your heart is being taxed, and now you've pulled out a 2-year-old child who now you have to live with that image the rest of your life, and now it's causing emotional distress, and then you drag that emotional distress home. Mm-hmm. Probably no other person in this world that's seen this movie besides Chaos Theory, besides me, because I think only one person watched it. But it's kind of about the spiraling effect, right? One thing happens, and then then you're on this whole deal, and a firefighter's career is very much like that.
Yeah. So I don't know if this is the takeaway I was supposed to get from this. No, but I mean, I'm re-looking at the whole thing. Obviously I respect the firemen do, and they argue with but I'm going back to hearing you saying, like, it's not a matter of if, but it's a matter of when. For the most part, there's a large percentage of guys who are going to get cancer, and you're trying to fight for those and the healthcare benefits. And if you're just one of those unfortunate souls who happen to have a recurrence of cancer and you hit your maximum, your cap, you're just shit on. Mm-hmm. So it's like, thank you for serving, thank you for helping, thank you for saving babies and doing everything. And you have all this stuff that's happening on the inside that people can't see.
Right.
Why in the hell would you do that?
Right.
But without people who would do that, we wouldn't have the military, we wouldn't have firemen, we wouldn't have police. It's also what makes us the best country on the planet. Mm-hmm. But this conversation has really opened my eyes to a lot of stuff that I had no idea about. None, zero. And But that's what, that's what this podcast is for.
Yeah.
It's about listen, laugh, and learn. And I don't know who I have to write, but let me know, who do we need to write to help correct some of these things? If people out there listening are like, I want to write a letter to a person, who do we need to write?
Yeah, sure. So, basically, right now, a lot of these bills, again, they get held up in the North Carolina Senate. And it's important to say that we are not partisan. Our bill, the North Carolina House, is controlled by Republicans. Mm-hmm. Our bill passed the North Carolina House without any opposition. In fact, it was championed by a guy named Jason Sane. Jason's a legislator here in right next door to us in Lincoln County. Was a volunteer firefighter and just an all-around good guy. I have stood with Jason every time he's ran. If he sees this podcast, he'll retweet it. He'll say this is spot on. But Jason is now the approach chair and has worked very hard for us. John Bell is the Republican majority leader, has helped on these bills. It is not a partisan issue. But right now, you kind of have two factions that support what we're doing. Roy Cooper and the Republican-led House of Representatives from North Carolina. This does not hold true for the North Carolina Senate. And there's no real, there's no code to crack or anything like that. The North Carolina Senate is run a lot more rigid than the House. It is really very much controlled by Phil Berger, who is the Senate Pro Tem. We reached out to Dan Forrest, who is running for governor. As the lieutenant governor, he is technically the head of the Senate, has not been helpful. So, we try not to get into, hey, who should we be mad at, right?
Yeah.
It's not that. Politically, when we talk about some of these things, we take the same approach on the local level as we take on the international level. We support politicians who support us. Mm-hmm. It's that simple. It's no different than being an NRA member. Sure. Right? You would not support someone who doesn't believe in the Second Amendment, right? If you're an NRA person, we take the same stance. So there are senators here in North Carolina that we support. Jim Perry, out in the eastern part of the state, has worked on some legislation for firefighters. We appreciate what he's done for us. Senator Brent Jackson, big watermelon farmer, Sampson County, good guy, fantastic guy. Has worked on pro-firefighter legislation. Bill Rabin, down in the eastern part of the state in Hanover County, good guy. Senator Sawyer here in Iredell County has been very open to our ideas. She's newer to the Senate, but I think she'll be a help to us. But we cannot get some of these bills, over the hump with the more authoritarian regime that we have running the North Carolina Senate right now. And that's not to say that firefighters don't have gains. We have made a lot of gains. I've been the political director 5 years. I led a lot of different efforts to help in a lot of different areas that have passed the Senate. But these issues with cancer simply will not get it over the top.
I hear you. I don't have to like it, but I hear you. So tell us a little bit about what you guys are doing. You touched on it, but tell us a little more about what's going on here Wednesday, what time, and what people can do.
Yeah, so we are big here in the local, and I don't think I said this, but I am the vice president of the Statesville Professional Firefighters, and Justin Elam is the president. And Justin and his work here in Statesville has just been fantastic for the firefighters and for our local and for the Statesville Professional Firefighters Association. He has led sort of this event. And he's on duty tonight, so I'm his surrogate. And but basically, what he's put together is a partnership with Joe, which we love doing partnerships. For the last 6 years, we've worked in the area that's called Coach for Kids, And it's kind of a play on, you've seen these programs where you drop a coat off at the fire station.
Yeah.
Maybe help a kid, kid that needs a coat. But there's a problem with that. Now we got to go out and find a kid that fits this coat. It's got to be cleaned, right? So there's all these things. Our program gets brand new coats to kids in need in our Statesville school systems. Last year we did around 250 coats, brand new coats, kids in Iredell County. Great program. But that's one of the many things we do. We give to Iredell Christian Ministries, Matthew 5, Power Cross, lots of different outreaches that we have. Our own members, of course, benevolency is important to us, as we've talked about. But this partnership here is to really launch a firefighter beer that I don't think I'm allowed to say the name of the beer or anything like that. I think you have to come in Wednesday to get the full effect of that. But you do have the opportunity to buy a Statesville Fire Department shirt, Statesville Professional Firefighters shirt with in partnership with Red Buffalo. So again, I think it's supposed to be a surprise, but we're merging those two logos in some fancy way. And you can buy a mug and a shirt and a pint of beer, I think, is $25, I think. Again, I'm the surrogate, so don't shoot the messenger if that's $5 either way. But I believe that was the number, and those are the things you get. But the idea is, Joe's going to make a little money. Our association is going to make a little money for our benevolent fund to help in these programs I mentioned, and we're going to have a good time, which is important.
What time is the event here at Red Buffalo on Wednesday?
We're going to kick off around 6:30, somewhere in there. Firefighters, I know, are told to be here around 6, but probably 6:30 is a better time for everybody to roll in. Facebook probably says 7 and make me look stupid, but it's somewhere in that neighborhood. Firefighters, I know, are going to start rolling in around 6. At least come by, say hello to your firefighters. You don't have to buy a T-shirt, but we kind of expect you to.
No pressure, but if you don't, you can leave. All right, thanks. Josh, man, I appreciate you coming in. I want everybody to try, if you can. We're going to get this up as soon as possible to all the social media platforms, so it'll help spread the word of what's going on here at Red Buffalo on Wednesday. Get here 6:30, 7 o'clock, whenever you get here. Buy whatever the swag bag is, and just come out and help support local as always. And if there's any links that I need to put in the description, let me know. I'll put them in there. And I just appreciate you coming on, man.
Yeah,
and thanks for everything that you're doing for the city and for the state and for all the firefighters across hell internationally.
Yeah,
right.
Absolutely.
And by the way, you do a lot of stuff, man.
I do. I wear a lot of hats. But I really do enjoy it. And actually, I have my own company as well, so Spark Communications, do some political work. So if you're running for office or you're developing policy, reach out to me. All
right, everybody. We appreciate it. And thank you to Tate Design Company for my hats this year. Thank you for Statesvegas Clothing. Big shout out to Integrity Securities. Obviously, Red Buffalo for having us here. Thanks again, and we'll see you guys soon. Thanks.
See you guys.